just wanted to ask, what does public health mean to you?
Public health. I would actually, to answer that question, I'll give you the analogy that I usually give persons, because a lot of persons, they think that public health is literally just people who go to restaurants and give them letter ratings, or those who deal with sanitation, But the public health to me, it puts us in a position as superheroes. So we are the ones that are saving people before they need to be treated. So public health for me just means prevention. It means um, caring. It means, just being a superhero.
Yeah, that is awesome, and I really like that definition. And yeah, we definitely are superheroes doing the things that a lot of people don't really see. And
Mhm.
and I think that's one thing that public health gets overlooked for, because we don't see all like the good sanitation and all those things that go into preventing all those diseases and
Correct, yeah.
whatnot. So where did your public health journey begin?
I would say it began with Bridges, which is very ironic because Bridges began before I actually had the degree. So it began before I even knew it began,
Yeah.
So
So
that would have
so
been in
be, be,
2013.
before we go on, just tell people what Bridges
Mhm.
to the Heart is.
Okay, so Bridges Heart is a non-profit organization that was founded in Trinidad, so it's registered or incorporated with the Ministry of Legal Affairs here in Trinidad and Tobago. When it was initially established, it was to deal with the societal gaps, so relational gaps in society. So we had plans of working with vulnerable populations, whether it be disabled, elderly, homeless. But when we did start and we actually identified the gap that existed, which was that intergenerational gap, we kind of just stuck on it. So for the past, this year would be 7 years, we have been working with the elderly.
Wow, that's amazing. It's crazy that it's 7 years.
Right?
Yeah, that is amazing. So what sorts of things do you do at Bridges? Actually, before we go there, what
Mhm.
how did the idea start to want to have a nonprofit? Because that's not something a lot of people do in their bachelors.
Yeah. Well, I guess it was a combination of two things. The first one would be the story that a lot of people know, which would be I used to volunteer with other groups. And one day, one of the groups I used to organize with, two guys said, why don't you start your own thing? So that way, you could have the freedom to do what you want to do and to make a difference in your own way without always having to get approval or, take ideas and get shut down and things. And I was like, I honestly don't know. I mean, I'm like 20 years old. I don't know if I'll be able to actually manage, because a lot of other persons I would have known around that age who would have established NGOs, it wasn't very well sustained. Within a year, it had fizzled away, So I was like kind of this negative Nancy, like, I don't know, if I could really do it. But then I guess I started noticing things in society, and it was like, these things actually exist, and we don't really take it on. We overlook it so often. So and I was like, hey, why not? And then at that point, also I was doing my undergrad, and honestly, it was a pull, because I was failing organic chemistry like nothing, to the point where I was supposed to graduate. And because I failed organic chemistry and was only offered once a year, I had to postpone my graduation for like a year. And I was like, you know what? This might be exactly what I need right now to get me out of this little slump. So that's how.
Okay, and don't feel bad. I failed organic chemistry too. It's
what
a
a what
it's
a
a
course.
common thing. I know it's
Yeah.
tough. It's tough,
Yeah.
definitely. So what I know you guys work with elderly populations. How have you
Mhm.
guys transitioned working now in COVID?
Well, we have been put on a hold. The main project that we had or have is called the Adopt a Grandparent, which is kind of like a social intervention where we actually go to visit mainly the residential homes that are set up, and we interact with them for a mutualistic relationship where they can benefit from us and we can benefit from them, and also engage them. Just so that they're stimulated, whether it be socially, physically, spiritually, So for COVID, we had to stop that. However, one of the things that I've been saying throughout, all these things that I've been doing is that social or physical distancing doesn't mean a lack of love. It doesn't mean that you should distance your love. So we've been calling, checking in on them. We made sure that each home was okay, that they had, enough groceries, enough cleaning supplies, masks, gloves. So we've been working in the background for now.
Okay, well, that's
Yeah.
good to know, and it's definitely something that needs to be done, especially when the elderly are vulnerable populations to this disease. So they're definitely feeling scared or anxious in a certain way. So thank you for the work that you're doing.
Yes. Yes.
Yeah. So what exactly was the process to start an NGO in Trinidad?
So the actual incorporation process is pretty I would say straightforward. You start off by choosing a name, and that's the first step of the process. And you can't go any further until you identify that the name that you have chosen is actually very original, that no one else has it.
Mm-hmm.
And then they give you a timeline to get everything else, which is basically a board of directors, an address, a secretary, um, yeah, I think like bylaws, those sort of things. And then once those things are approved, that's it. So it seems very straightforward. The main challenge is the time. And for me personally, my main challenge was deciding on board members, because it's one thing to say like, I could choose somebody because they have a lot of followers and they would be good for social media presence, or because they're really good at administration. But to find someone who has the same passion and mission and vision, the process, that part of the process for me was very challenging. But other than that, it was smooth sailing.
Okay, cool.
Yeah.
So while you were in California, you were still running Bridges to the Heart. What was that like?
It was challenging, but I had slash have a very good team. So while things did, it wasn't as active as when I was there. They didn't let it die. So they still did the activities and stuff. So I have to give kudos to them, because I couldn't do it, like actually do it. But yeah, it was my team.
Okay. And
Yeah.
what is your organization structure like?
We have uh, the board of directors, which is one, two, three of us now. It used to be four, but now it's three. And then one of the members of the board also functions as the secretary. So those are the actual registered persons. And then the other tier would be, we call them like, I don't know, we don't really have a name, but they support in marketing and legal and that kind of thing. So it
Okay.
is a very short, concise structure, but it works.
Okay. And once it works,
Yeah.
don't change it, right?
Yeah.
Absolutely. So,
Yeah.
what skills do you think you took from your MPH that helped you with Bridges to the Heart,
Mhm.
if any?
Um, I would say, okay, there were a lot of obvious ways. So like in my electives, I did a course on nonprofit leadership. So, I mean, it would be kind of self-explanatory that that did help. But other than that, I would say simple things like teamwork. I mean, teamwork is so important in public health. Having that multidisciplinary team, evaluating the projects that you're doing to make sure that it's doing what you want it to do, that's making a meaningful impact. Needs assessments, as we talked about, those are a few that would have um, helped me in, kind of structuring Bridges after.
Mm-hmm.
Yeah.
Okay, so talking about evaluation, what sorts of metrics do you use for Bridges?
Well, okay, so that's a very tricky question. We tried to evaluate. So we did one evaluation, that's the truth. Um, and that was after the pilot, to decide the pilot of the adopted grandparent, to decide whether we wanted to proceed with the project or not. Um, and we got the help of a psychologist. At that point, I think she was I don't know what's the correct term, a geriatric psychologist or something. So she did the evaluation for us. But now most of our evaluation, I know it kind of sucks because I'm a public health person, but it's a lot of qualitative. So we just go on feedback of the elderly persons and of the caregivers in the home.
Okay. Very interesting.
Yeah.
Interesting.
Yeah.
Okay. And what are the hopes for Bridges to the Heart going forward?
Ideally, I would like Bridges to the Heart to be like a powerhouse for the elderly and by extension the vulnerable, like a voice for those who have a voice but are not easily heard. And I guess in my long term, I would ideally love to establish a home of my own, a home where things are done right. I know that's a very broad statement to make, but a lot of elderly homes, they don't always consider their residents. It's more of a business venture than actual living accommodations for somebody who has spent their life, helping us. And, it's not really, there's no human aspect of it. So I want to provide that,
Okay.
So I guess ideally that would be like a 10 years plus goal.
Okay, I love it. I love the big goals.
Yeah.
I love it. So, what was I gonna ask? Okay, let's talk about your role as a. Actually, no. Why are you interested in working with elder populations, particularly?
Why am I interested? That's a good question. The truth is, I don't know. I think that I am a very empathetic person, and that has a lot to do with it because, you live life as a millennial, as a young adult, a full-fledged adult, and we tend to be very selfish regardless of our age. And it's not selfish as in we're horrible people, but it's selfish as in human nature. So I think I was drawn to the elderly because in our selfishness, they are very easily forgotten. They are very easily overlooked. And I just wanted to touch on that. Like, hey guys, we remember that you're here. We love you. Like, we see you. We are here for you. We want to help you. So yeah, I guess that's why.